Hi, this is the video presentation for Claire Hyde, Heather Borders, Morgan McNeil, and Sheila Norris. Our topic is vitamin D and cardiovascular disease. Vitamin D has historically been associated with bone health. However, more recent attention has been placed on the relationship between vitamin D and cardiovascular disease.
Big headline about health from a study of almost 1 million people. Today, a new report says you can cut your risk of cancer and heart disease by paying closer attention to a vitamin, vitamin D. Here's ABC's Mara Scalvacampo. It's a spring ritual, getting reacquainted with the sun, and a critical one, too. The major new study of nearly 1 million people finds the lower your vitamin D levels, the higher your risk for certain diseases, including a 35% increased risk of death from heart disease and a 14% increase in death from cancer. Vitamin D not only helps block a host of major illnesses, it can boost your heart and even strengthen your bones. This while an estimated 2/3 of the population isn't getting enough. So just how do you raise your vitamin D levels? Well, for one thing, spend more time outdoors. Doctors recommend about 1 hour of time in the sun per week, and they say to expose as much skin as possible. Of course, experts say you have to take precautions not to get too much sun, and they point to the vitamin D you can get by eating more salmon, mushrooms, and fortified dairy. For middle-aged and older women, vitamin D3 supplements can help too.
Food sources are really limited, so it's best for most people to take a supplement.
But this spring, experts say the best thing to do is get outside and soak up some sun.
Now, that 1 hour of recommended sun time can be spread out over the entire week, and doctors say that amount, just a few minutes each day, generally won't increase your risk of skin cancer, Diane, or other problems that come with too much sun exposure.
And again, you can use some protection.
You absolutely can.
All right, Mara, thank you.
Vitamin D is a fat-soluble vitamin and is essential for bone health. We receive vitamin D from limited food sources and exposure to sunlight, but also from supplementation. While osteoporosis is a well-known health risk associated with deficiency of vitamin D, new research is suggesting that the development of cardiovascular disease can also be an issue as well. Low vitamin D levels are linked with cardiovascular disease. Taking a look at the literature, recent research has demonstrated an association between vitamin D deficiency and cardiovascular disease. Recent research has identified a positive correlation between vitamin D deficiency and various cardiovascular diseases, including diabetes, cardiomyopathy, high blood pressure and blood lipids, obesity, and early mortality. Furthermore, vitamin D metabolism has also been shown to be involved with the regulation of the renin-angiotensin system and therefore associated with high blood pressure and hypertrophy of the vascular smooth muscle cells. It's also associated with high inflammation markers. People who have low levels of vitamin D are also thought to have an increased risk of diabetes, and the mechanism is likely due to a plasma calcium regulation in which in turn regulates insulin synthesis and secretion. In the same study, participants with vitamin D levels lower than 37.5 were found to have just over twice the risk for heart attack as compared to participants with vitamin D level concentrations over 75. Furthermore, increased TNF-alpha concentrations are also considered a risk factor for congestive heart failure as well as coronary heart disease mortality. In order to prevent these vascular diseases from progressing, modulation of vitamin D signaling has been shown to be a possible area for therapy. Supplementation has also significantly improved survival of cardiovascular disease patients with those that have low vitamin D levels. Optimal doses are uncertain. However, research suggests that supplementation between 1,000 and 2,000 international units every day can ensure optimal serum levels. In conclusion, the significance of low vitamin D levels can be significant for individuals with cardiovascular disease, as it's the leading cause of mortality around the world. Preventative measures and strategies to diminish the occurrence of this disease are to possibly treat it with supplementation, as well as to go outside and experience sunlight for just a few minutes each day. Obviously, further research needs to be done. However, there are signs that low vitamin D levels are a cause or correlated with cardiovascular disease.